Some schools in Massachusetts are giving students the option to go maskless, but only if they're vaccinated against COVID-19. A recent article in the Boston Globe took a look at the state's COVID-19 data, and it found that most of the districts allowing students to ditch face coverings have not seen a major increase in positive cases. So Naomi Martin wrote that story. She's an education reporter for the Boston Globe, and she's here with us now. So this is really fascinating. So I am in Pennsylvania, where the discussion of not wearing masks is in schools not even coming up at all. So I'm curious, first off, why this policy was even implemented, why this option was even implemented. Were teachers, students, parents asking for it? How did it come to be?
Yeah, so Massachusetts is one of the most vaccinated states in the country. And I think that was one of the drivers behind this policy, where policymakers over the summer felt like they wanted to go back to normal as much as possible after a lot of disruption, a lot of remote learning over the last 2 years. And they felt like the fewer restrictions, the better. So they did want to give students this off ramp. They said, if you reach 80% of students and teachers in a school that are vaccinated, then you can allow vaccinated students to take off their masks. There was some controversy over this policy. A lot of scientists and medical experts were raising questions about where did they get this 80% number? And, there's not really a lot of evidence behind it. But a lot of schools and families felt really happy about it because they felt like it would give their students, a drive to get vaccinated, and they would then have a safer environment to take their masks off and have a more normal school experience.
Okay, so let's look at the numbers. This happened in Hopkinton High School, and we should point out that obviously this is not a big town, right? It's a smaller town. The other mask optional schools saw a small uptick in cases after the Thanksgiving holiday, but the numbers have actually remained steady since. So what did these numbers tell us?
I think it's kind of hard to know how much of the increase is related to the mask optional policy. I know a lot of people feel like it's just not safe to have the masks off at a time like this, and a lot of teachers especially feel that way. But in terms of what the other side is saying is they're concerned that they don't want this increase in cases to make people give up on letting students take off their masks, because there are benefits that the students felt with, like, improving their learning experience and learning languages and things like that, and their social emotional functioning. So they felt like, this could be tied to students getting together outside of school, not wearing masks. And actually a lot of the cases in Hopkinton High that happened last week, there were 34 in 10 days, where they had only had 9 throughout the rest of the year. And they were tied to the basketball team. So it seemed like that was more related to a sports issue as opposed to being in classrooms. But again, it's really tricky. And also we're seeing a rise in cases overall with Omicron. So it's just hard to know what's really going on.
But what didn't happen was some sort of super spreader event within these schools.
That's what the data appears to show so far, but it hasn't, like I said, it hasn't been that long, and it also hasn't been totally clear. It's hard to draw a straight line, I guess, between, but so far the schools haven't seen that.
Yeah, I think you're making a really good point. And I think this is, sometimes people get frustrated even with sort of as the experts talk, is that, all data that we're getting, because all of this is quite new, is sort of preliminary data. It's really hard to determine the specific factors that have resulted in this outcome. Yes, there's high vaccination rates, but also, beyond the school, we're talking about a smaller community. We're not talking about, a New York City or a Chicago or a Boston. So there are just fewer people interacting with each other. I thought it was very interesting, though, the other sort of learning impacts that you talked about, and you just sort of mentioned a bit in the article. The way masked the students who chose to be masked, or the teachers who chose to remain masked, how they felt about the learning experience, and how those who took the mask off felt about the learning experience. Can you sort of just give us some highlights, the pros and cons of taking the mask off, keeping the mask on?
Yeah, a lot of students told me they felt like it was freedom. It gave them a sense of normalcy. They had much more smiles. It was great to see other kids smiling. One girl who was a sophomore, so she had basically gone through that transition of middle school to high school during COVID. And, it was all very masked and like a lot of remote learning last year. So she was saying that this was the first time that she felt she could actually make new friends in high school as a sophomore because, you're able to talk more easily with people that you don't already know without a mask on. And so I think there have been a lot of social benefits to students. And then I also heard about languages and how much easier it was for English language learners and students learning foreign languages to understand better and communicate better without masks on. They felt like they had better classroom conversations. Some of the teachers also said that they felt the classroom conversations had gotten better and they could better understand students' understanding of concepts. But they also were more hesitant to approach unmasked students, and they were hesitant to assign group work. They were fearful about, some students still kept their mask on, maybe had high risk family members, and so they didn't want to make them uncomfortable by having to work with an unmasked student. So there was a lot of issues around people's different comfort levels, and high risk teachers, pregnant teachers. Things like that. A lot of them asked students to keep their masks on. And at least at Hopkinton High, it didn't sound like any students objected to that. And then some teachers asked to keep the windows open. And so students would keep their coats on in class.
So I've been talking about how this is happening in an area with smaller towns. I just wanted to sort of show a graph here. Those schools that have been mask optional are in all smaller towns. This graph here, you can see that Boston and Worcester, the two biggest cities in the state, have seen the number of cases increase over the past month despite having a mandatory mask mandate. And cases in the towns that have mask optional schools have stayed pretty low. So what is the thinking from experts? Is it just because we were talking about bigger cities that, the overall community, the overall population already has sort of higher cases? How do sort of experts explain this?
I think a lot of experts would, look at these numbers and say, like, of course, a city with, millions of people in it is going to have much higher numbers of infections than a town with, just tens of thousands. But I also think that, and obviously we know that school COVID rates tend to reflect what's happening in the community. They don't, happen in a vacuum. And so, we have seen, the experts do say there's very little transmission happening in schools, but you can't stop people from getting COVID in the community and bringing it into schools. So that's one reason for the disparity. And then I think in cities, obviously, we still have, huge disparities in terms of who's able to work from home, who has to go to work in person, essential workers and people who just face more risks on a day-to-day basis that, may not have a choice in the matter. So as well as the school buildings themselves, a lot of these suburban schools have a lot more money and have nicer ventilation systems and air filtration systems and things that help mitigate the COVID risks in a way that these urban schools that have been underfunded for a long time struggle to do and may not have the ability to do.
That's so fascinating to me. It's just like over and over again, one of the things that the pandemic has done is shine a light on the cracks in the system. And anything that was underfunded, whether it be schools or portions of the healthcare system, buckle under the pressure of this pandemic. The state's mask mandate for schools will expire next month. Is there any talk of extending it now that we're seeing the Omicron variant spreading?
There definitely is talk of it, and a lot of people are pushing the state to extend it, but then a lot of families who feel that their students shouldn't have to wear masks are pushing the state to not extend it. And so there's been a lot of very emotional testimony at the State Board of Education meetings about this, and the state education commissioner recently said that he will announce in early January whether he's going to extend it or not. But right now it does set to expire January 15th, and then local communities would have the ability to set their own mask mandates. But a lot of groups, including the Massachusetts Teachers Association, feel that the state needs to take a leadership role on this because it's such a divisive issue in communities, and it's unfair to put it on school boards, which don't have the same access to medical experts as the state does.
Totally. You got sort of a handful of volunteers that thought they would be, talking about, I don't know, textbook purchases. And now they find themselves in the middle of this very divisive political medical storm. Naomi Martin, thank you very much.
Thank you.